While votes continue to be counted, we are learning more about how the coronavirus pandemic factored into voters' decision-making. A CBS News exit poll suggests that a majority of people who voted for Joe Biden believe tackling the coronavirus is more important than buoying the economy. For President Trump voters, the reverse appears to be true. For more on this, let's bring in Dr. Neeta Ogden. She's an internal medicine specialist and an immunologist. Dr. Ogden, I oftentimes don't like these questions when they're asked to voters because it suggests that you have to be one for one or the other. It is possible to contain the pandemic and also have a vibrant economy at the same time, right? Hello, South Korea.
Good morning, and you beat me to my answer. That's exactly what I was going to say, that it's exactly this kind of polarizing rhetoric that it's one or the other, that it's lockdown or no lockdown, that gets us in this very tricky and messed up situation with COVID. And really, if we could just understand that they're inherently tied, that proper control of the virus through national efforts, a national mask mandate, a national concerted effort to get PPE, to do public health, to start rolling out the vaccine, these will all turn into positive results for the economy. As long as we falter with COVID, which is not going away anytime soon, we remain in this messy area where the economy does falter. So this is the problem. It's that kind of language that really doesn't look at this from all aspects and how it's a 360-degree problem, not just one or the other, not black and white. Really controlling the virus will allow us to open up our economy.
So this is a story that we didn't talk a lot about yesterday because it was the election. The coordinator of the White House Coronavirus Task Force, Deborah Birx, has contradicted the administration, saying that much more aggressive action needs to be taken to curtail the pandemic. The reason that this is newsworthy is because she has really sort of thread the needle for a very long time between what the administration has said and what the overwhelming abundance of scientists and doctors have been saying about how this pandemic needs to be handled. This was the first time we have heard now that she was being overtly critical of what the administration has done. What is she saying needs to be done to bring this pandemic under control here?
Yeah, I think Dr. Birx is speaking to the facts, which is that over 30% of the counties in the United States are seeing surges. Over half of the United States is looking at red and orange zones. So we're seeing a rapid surge here of coronavirus. And she's, again, talking about this polarizing language about that, when we really look at the science, this is not about lockdown versus not lockdown. It's about having an aggressive, balanced approach. What does that include? Well, the Infectious Disease Society of America just came out this week talking about needing these sort of national plans. We do not have a national message around coronavirus like South Korea does. This is what helps control the virus. When we have leadership that provides us with sort of standards by which we can navigate this pandemic, that helps. Right now, we're, again, in this messy situation where there's no language that's sort of unifying the country about how they can handle this in their own home, in their own personal life. And that is what Dr. Birx is speaking about, that without that kind of level of control, which would come from higher up, we're going to continue to see this virus surge throughout the United States, and that can only lead to more morbidity and mortality.
It strikes me, Dr. Ogden and Anne-Marie, that if early on in this pandemic, the President of the United States had just said, everybody should wear a mask, everybody should socially distance, and he had not turned it into a political football, we would see a different not only would we see a different number in the number of people infected and killed by the coronavirus, we might even see a different outcome in the election. In other words, if you see that people who are exit polling are saying that the coronavirus is really important to them and the economy is also really important to them, how different things might have looked if the president had just said, let's everybody wear a mask, let's everybody try to socially distance. Governors, decide what's best for your state, and let's try to do some kind of coordination. What works for New York may not necessarily work for Florida, but let's work together to make it happen, as opposed to language that suggested that wearing a mask was somehow an infringement of personal liberties or liberating states who had implemented lockdowns. We might not be in the situation that we are in right now. We could then perhaps look a little closer to South Korea. Now, I do point, we've been pointing out that you're starting to see spikes in Europe again, and many countries in Europe are seeing lockdowns. So Dr. Ogden, what is the difference? I mean, European countries did implement some of the measures that we're talking about right now, and yet they're also still seeing a surge. What's going on?
Well, I think part of it is that we know what works to help control the virus, and that is taking certain steps to control human behavior, frankly, which means, what we kind of saw in March. We certainly want to avoid those kinds of extreme measures, and I think what you're talking about makes a lot of sense. And Europe is trying to do this, where it's more regional lockdowns, where restaurants or bars and things like that are closed at, not completely, but at a certain time. So you see these kinds of curfews. So they're trying to take these measures that might help rein in human behavior, which is to go out and be social, and ultimately leads to these surges in the time of coronavirus, and rather than completely creating lockdowns. And I think in the United States, we just never got into, there's so many different regions where the coronavirus is slowly touching. And I think that reflects on what sort of happened with the election, like people who experience coronavirus firsthand with friends and family members or their healthcare workers. They might view it differently than, some of these Midwestern states where it's only now we're seeing some of the really high surges happening. So those are smaller countries, and I think that they are handling it more regionally, whereas it's still, it's still touching some of the places in the United States for the first time, and that sort of lag has led to this sort of constant surge that we see in the United States now with these, crazy high daily case rates, which it's kind of unbelievable.
I want to ask you about some new research about N95 masks and how they fail when reused for more than 2 days. I find that very concerning because, despite the president bragging about how hard the administration has worked to get enough PPE, we know that there are hospitals out there where doctors and nurses are still reusing these masks. How concerning is this new study to you?
So concerning and not surprising. As a doctor, I've never heard of reusing N95 masks. So I'm not surprised. These are masks that work within a certain protocol established by OSHA. They have a correct size and a correct fit. They're not supposed to be used even more than 1 day. So when this study showed that when used for longer than 2 days, there's a 50% fail rate, I'm not surprised. It's unfortunate that we were in a situation, there was a worldwide shortage of N95 masks, so the CDC created protocols to extend their use, but they simply don't work, and we're putting our healthcare workers at risk. So again, I sound like a broken record, but I do think that the billions of dollars that are being used towards, for example, warp speed, could be used towards a Defense Production Act to allow for enough PPE in this country that should be able to have those kinds of resources.
Indeed. I mean, these are the men and women that are putting their lives on the line for us. These masks are supposed to be used one per patient, much less for an entire shift, much less more than one shift. And we're, we're in November now. At this point, everyone in this country should be covered that needs a medical grade mask. Dr. Neeta Ogden, thank you so much.
Thank you for having me.